The type of preparation selected for each of the patients was selected at randomization. The incision site was swabbed and cultured before the incision was made and 18 hours after post-op. The females were seen approximately 14 days after surgery, and their sites were examined for any type of infection. In the end, there were 33 patients selected for a povidone iodine and 27 for the chlorhexidine. The 3-minute culture swab showed no difference in growth for bacteria between the two disinfectants. At the 18-hour post-op culture swab, 16 out of the 33 patients have received povidone iodine had bacterial growth at the 18-hour post-op mark, and 3 out of the 27 have received chlorhexidine had bacterial growth as well. There were no wound infections documented on post-op 14. This article compared the effectiveness of povidone iodine and chlorhexidine gluconate in preventing post-op surgical site infections. The patients aged anywhere from 18 to 60 years old and had to be undergoing elective, clean, or contaminated surgery. This was a double-blind, randomized controlled study. The participants were labeled into 2 groups based on what pre-op prep was used on them. Group 1, which consisted of 201 patients, would be prepped with povidone iodine, and Group 2, which had 151 patients, would be prepped with chlorhexidine. Participants had to visit the outpatient department weekly for their incision site to be assessed for any type of infection. If any incisions showed signs of infection, these wounds were then swabbed and sent to microbiology for culture and sensitivity. If there were no signs of infection 30 days post-op, the patient's incision was considered to be infection-free. Group 1 had 22 develop a surgical site infection, which was the group with the povidone iodine, and Group 2 had 12 patients develop surgical site infections. This article compared chlorhexidine and povidone iodine in the prevention of surgical site infections after a C-section. There were 1,147 pregnant females who participated in this controlled study. There were 572 randomly assigned to chlorhexidine and 575 to povidone iodine. The patient's preparation was applied, and there was a wait time of 3 minutes before the incision site was made. A total of 23 patients prepped with chlorhexidine and 42 patients prepped with povidone iodine were diagnosed with a surgical site infection. Students were to describe a design, setting, and sample of characteristics of a research study that we might conduct one day. The type of study that will be performed is a randomized controlled trial. This study will take place from October 2017 to October 2018. This study would take place at 4 acute care community hospitals in southern Indiana. Participants must be opting to have an elective abdominal or gynecological surgery. The intervention for the study will be either chlorhexidine gluconate or povidone iodine. The patients will be separated into 2 separate groups. Patients will then be randomly assigned one of the 2 preparations. Group 1 will receive povidone iodine and Group 2 will receive chlorhexidine. Ideally, each group will contain 100 to 150 participants. An informed consent will be obtained from each participant. Baseline data will be collected before surgery takes place. The type of data that will be collected will be like medical history, allergies, vital signs, and blood work. The nurse will prep the participants with assigned prep, and there will be a 3-minute wait time to allow for the preparation to dry. Their surgery will then go on as planned. In the post-op phase, nurses will assess the participants' surgical sites before. We'll assess the participants' surgical incision sites. There we go. Before being discharged from the facility, the nurse will perform a sterile culture swab for the incision site. The sample will be tested for the culture and sensitivity. 2 weeks post-op, the participants will be called by telephone and a nurse will ask about any signs and symptoms that the participant may be experiencing from the incision sites. At the 30-day follow-up visit with a surgeon, the nurse will then again perform a sterile culture swab of the incision site and send the sample for bacterial growth. The 2 different results from the culture swab will be compared. Assessment of the incision site will be performed to check for any infection. Vital signs and blood work will be compared to again. Once all post-test data is resulted, the 2 groups' outcomes will be compared and contrasted. Don't worry, we're almost done. Students had to find an instrument tool they wanted to use to collect data in their research study. And then they had to describe the data analysis that will be conducted to analyze the data that was collected from that instrument. This will be a mixture of objective and subjective data collection, the nurse assessment of the surgical site before, post-op, and 30 days after surgery will be subjective. The phone call between the nurses